You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. If you are missing one tooth, and especially if you have a loose-fitting denture, my advice, stick around for the latest edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering dental implants. My first guest is an expert on the topic, Dr. Wayne Brueggen. Dr. Brueggen, welcome to the program.
Well, thank you for having me, Randy.
Now, before we get into today's topic, Brueggen Dental, one of the busiest practices in all of Houston. What type of patients do you see there?
Randy, we see all kinds of patients. You know, it's a family practice. My passion's dental implants, but I have an associate, Dr. Ernie Escobar, and another gentleman there that does periodontal work. So we do everything from veneers, cosmetic dentistry, to root canals and crowns and everything.
So not just dental implants, but that's a big part of your focus, isn't it?
Well, it's primarily all that I do.
It's all that you do.
That's correct.
Now, background and training. You've been doing dental implants since 1976.
Yeah, it was always intriguing to me. When I got out of school in '76, I went to work for a gentleman that did nothing but dentures. All he did. He was a dentist. I made him a set of dentures, so obviously that's what his patients had. Well, it didn't take very long for me to realize that the folks that were wearing dentures were crippled. They had some really serious problems, and there was no solution to them. Things that we were doing traditionally in dentistry just didn't work for most people, or for many at least.
So denture wearers benefit the most, you say?
I think that probably wouldn't be wrong to say, but the people who benefit the most are people who either don't have any teeth, or they've been told by their dentist that they can't keep the ones they have. They're about to not have any teeth. Those are the people that benefit the most. But anyone who's missing a tooth or a few teeth
should go with dental implants.
Absolutely.
Sounds very painful, by the way,
yeah, well,
going through the process, getting a dental implant put in.
Well, you sound like a typical patient.
All right. Is that their fear? Is that what they say to you?
Yeah, you bet. Most people would think that having an implant placed would be a difficult procedure, uncomfortable, but it isn't. You know, I told you a moment ago that one of the things that have changed a lot are the techniques, and that's the biggest thing. The surgeries right now they're so gentle, they're so non-invasive. If incisions are made at all, they're so small. The healing time is almost insignificant.
So they don't complain about pain?
No, Randy, they don't. I know it's hard for you to believe. It's hard for everyone to believe that hasn't had it done, but they don't. The reality is I have patients come in, Randy, that have a dozen teeth removed, have implants placed, and have a full set of new teeth put on those the same day. That evening they're eating a light meal, and the next day they're back at work. They're taking a little Motrin. I mean, that's how it is.
Now, is it because now there's not a lot of pain because the bone itself, you know, putting it in, that's not painful? Is that right? I mean, there's no feeling in the bone.
That's true. And so the only feeling that you're going to have is what's in the tissues, and since the incisions are so small, there's not much to it.
What about the age ranges of your patients?
My youngest was 21, my oldest was 96.
96. Now, why would a 96-year-old want to get dental implants?
Well, same reason you would. They want to have a good quality of life. They want to be able to smile and speak and eat the things they enjoy. It may be more important to them. They may have fewer things that they're getting to enjoy in their life than you are.
So a 98-year-old is healthy enough to get a dental implant?
Sure.
Okay.
Absolutely.
And they stay now. And was it painful for that person?
No. It's no different than it would be for anyone else.
Is that right?
Yeah.
Now, anticipating this interview, my mother, she's 73 years old, and she's been a denture since she was 28. So that's a long time.
That's a long time.
And she tells me, she says, Randy, because I told her about you, we had a conversation on the phone. Says I'm too old. My medical doctor said I'm too old for dental implants. I mean, is that common?
Well, I hear it all the time.
And is it true?
Well, it isn't true, obviously, and I think you need to let me talk to your mom for you.
Okay,
because she doesn't have to live like this.
She doesn't believe
it. She doesn't. I know she doesn't. A lot of people don't, but it's true. She's been wearing these things for so long, she doesn't even realize the compromises she makes. She eats the things that she can eat. That's what she's become accustomed to.
Does she avoid certain foods?
Oh, well, of course, and she probably doesn't even really think about it much.
What about, I mean, is she going to have to get a bone graft? I mean, somebody that's in their 70s? 70's young today, but, I mean, are you doing a lot of bone grafting?
Not much. She might not, but not much.
Is it coming from the hip?
It could.
Or you have synthetic materials?
It could, both.
Okay.
All of those things. But the reality is that, especially for about the last maybe 8 years of my practice, I've really focused on trying to find approaches that allow me to do these reconstructions without the grafts. Obviously, I can't do it every time, but I can do it almost every time. On the lower, virtually 100%, I can rebuild without any grafting at all.
So what are the different categories of dental implant patients that you see?
Well, you know, Randy, it's fairly obvious. You have a patient sometimes that maybe they just are missing one tooth. That's a category of a dental implant patient. You have others that may be for, who knows, any number of reasons. They may be missing 3 or 4 or 5 teeth. That's another category. And then you have a patient who either has no teeth or they're about to have no teeth and they need dental implants. That's another category.
You say people hang on to their teeth too long. They go to their general dentist, they say, your teeth have to go, and they still hold on to them.
Well, some do, some don't,
okay,
Randy. You know,
okay.
some don't hang on to them long enough. But oftentimes, especially because as dentists, we were all trained to keep a tooth for as long as we possibly could. That's just what we're taught to do. They're almost sacred to us. And in the past, implants have not been the dependable solution that they are today, and so we've made tremendous efforts to keep people's natural teeth. So between us and our patient who naturally wants to keep them, we hang on to them too long.
So would you like to see more of those patients, the people that are watching this, that they've been told your teeth have to go? And they have a choice, I guess, between dentures and dental implants.
Well, not only would I like to see those patients, but every one of those patients would like to see me or someone like me. No one in the world wants to remove their teeth and go into dentures unless they
Well, why doesn't everybody do it?
option.
Because I mean, I'm looking online, 20 million people are wearing either an upper or lower denture. If it's as good as you say it is, why aren't they all doing it?
Well, there are 2 or 3 reasons they don't do it. One of the reasons is because of the dentists themselves. As I mentioned to you earlier, we were not trained in 1976 in school to do dental implants. Dental implants is something that have come along over the last 30 years. And
so it's new,
now,
new to even a lot of dentists?
And now it's becoming fairly
Okay.
mainstream, but you know, for a dentist who's been practicing for 25 years that didn't get any of it when he was in school, it's new to him.
So denture wearers, you say they don't really go to the dentist very often.
Well, no, they
So
don't.
nobody's telling them to do it.
You know, they think they don't need to go anymore. They don't have teeth any longer. Now, their dentist isn't telling them that. Every dentist who's taking care of a patient dentures tells them he'd like to see them once a year, but they don't do it.
They don't go.
No, they don't go.
And they don't like dentists. I guess when people that have lost their teeth have gone through so much,
Yeah.
the last thing they want to do is go see another dentist, right?
Well, that's
Or
a
no?
good observation. You know, obviously, anyone who's wearing a denture hasn't had a happy life in a dental office, and it's probably not their favorite place to be. Absolutely, that's true.
Okay, the interesting thing, though, you say that nowadays with as little as 4 implants, a denture wearer, lower denture, can get something fixed in their mouth. Is that correct?
Lower. Upper or lower. Absolutely.
Is that right? Because people, I guess, you know, going into this, you know, you count your teeth, and my mother too, you know, she said, it's very expensive, but you say 4 implants, and that's it.
Yeah, you know, that's a good observation as well, because I have people that email me all the time, and their question is, well, I need a full set of dental implants. And
Yeah.
a full set of dental implants to them probably means an implant I'm not sure what it means when they say that, but it probably means an implant for each tooth. And they're asking me, well, what do we do? How do I go about doing that? What's it going to cost to do that? How long is it going to take? What's it going to be like? The truth is, they're not looking at the same thing I'm looking at. And they're looking at 1 implant for each tooth, and I'm looking at putting in 4, 5, 6 implants, usually 4, and building a full set of teeth on them. So I tell them, come see me and we'll take a look and talk about it.
Now, one of the things I thought was great on the phone, you say that if there was a try-in period for denture wearers nationwide, where you could give them 4 to give them something fixed, they couldn't go back. You
No
believe
one.
that? I mean, do you really believe that?
There's nothing in the world I believe more than I have never, ever had one patient, and I've been doing this for over 30 years,
Okay.
and I've been doing this 4 implant business with the fixed hybrid that we're talking about right now in one day.
So one day, somebody without teeth goes in, the right candidate, and you give them something fixed in their mouth.
Yeah, and I
Okay.
have never, ever seen anyone who would be willing to go back under any circumstance.
You say you're changing people's lives. You brought some photos. We're going to take a quick break first. Come back, and we'll talk about the process too, and also the different options for denture wearers.
Okay.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Up next, I've taken a look at these photos, dramatic photos. If you are wearing a denture, you have to see this next segment. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. With us we have Houston's busiest doctor doing dental implants, probably the go-to guy. Is that right, Dr. Brueggen, for dental implants?
I would hope so.
I mean, that's pretty much all you do in your practice.
Pretty much.
Dental implants. Now, you
That's
say
all I
this
do.
is a happy group of patients.
Yes, it is.
And I accuse you of exaggerating.
Yes, you do.
I said,
that.
you say you're changing people's lives. How so?
do.
How so?
You act like you doubt that.
Well, seems like an overstatement, but
Yeah.
you're biased, you're a dentist, you think teeth are pretty important.
Yeah, I do. And I'll tell you what, Randy, I could tell you all about it and explain to you how I changed these lives, but picture's worth 1,000 words. I brought this book.
All right.
Let's take a look.
All right,
And you
okay.
tell me what you think.
All right, okay, so we'll take a look at
Yeah,
this. So
let's
you
take
made
a
this
look.
book for patients to look at.
You know what? I'm proud of this book.
Very nice.
This book it's not a professionally done book. My associate, Dr. Escobar, did this, and I'm really proud of what he did. I'll show you some pictures.
Okay, okay.
Here's a woman. Look at the smile. What do you see?
It's not good.
No, it's not good. Do you think that she's happy with that?
No.
You know what this lady told me? She told me that people, they judged her, that they felt like she was not good enough, that she didn't take care of herself, that there was something wrong with her.
Did
She
the
hit
teeth
her
just break
smile.
off?
Well, they just
they almost look like
they just gradually went bad, one at a time.
Is that rare though? I mean, I don't see that very
Oh, it
often.
happens all the time. The reason you don't see it is because just like this lady, she said I was embarrassed, so I kept my hand in front of my face all the time. People couldn't see me smile, and I didn't want them to see me smile. She was like this for only one reason, Randy. She was scared. This lady was scared to death to go to the dentist. She just desperately wanted help, but she couldn't get herself in to do it. Finally, Randy, she looked like this. And when she did, the discomfort of looking this way was powerful enough to motivate her to come in and see me. And when she did come in to see me,
All right.
it took her one day, Randy, to look like this beautiful woman.
It's very nice.
Now, Randy, look at this. And you tell me that this lady's life hasn't been changed.
Yeah, when you
Yeah.
put those side by, I mean, she looks younger too.
Oh, and
it's very pretty.
Well, she's beautiful and
Interesting, big difference.
look at the excitement in her face. Just look how she feels about herself.
What does she say to you, by the way?
She tells
when it's
me
all
that.
done? I mean, when she looks in the mirror, is it emotional for you?
Oh, she's thrilled. This lady is happy enough. Now think about this, Randy. Would you want someone to show this picture of you?
No.
No, but she gave me permission to show you this picture. She's so excited and thrilled with what's been done for her that she's willing to put herself out there, let other people see this so they know what's available for them. Well, that says a lot.
So there are more women that come in than men to
No.
take care of their teeth?
No, for pure cosmetics, when we're doing veneers, things like that, I'd say a few more women. Not necessarily a lot more, but a few more. But for this kind of work, absolutely not. I'd say it's 50-50. Age is the same thing. We see young men, young women, and folks that are more mature. Let's look at a man.
All right, all right.
Look at this gentleman.
Oh boy.
Yeah, oh boy. Look at what this guy looks like. This is a successful businessman. This guy...
Now that's pretty bad.
Yeah, that's pretty bad. You think that's pretty bad? Look at this. This is what he had to get to before he was motivated enough to come in to see me. And the guy, the only reason he looks like this is the same as a lady, scared.
So afraid of the dentist.
Yeah.
So was he told, by the way, those teeth have to go?
Well, yes,
And
a
he
long,
just
long
held
time.
and he just held on to them.
10 years ago, but he didn't do it because...
So he told you, he said, I just didn't want to go through the pain of the dentist?
Well, he said he was afraid to go to the dentist.
Okay.
And he also said he didn't want to wear dentures. And he didn't know there were alternatives. And he knew they were going to pull all these out, and that's what was going to happen.
Now in this consult, I mean, are they pretty ashamed of this? I mean, do they reveal that they just don't smile? That it really affects them? They avoid dating or whatever, social activities?
Some are ashamed. I'm not sure ashamed, Randy's the right word. They're embarrassed.
Okay.
You know, they're just embarrassed, Randy, just like you would be. You know, they cover their mouths. They don't want to smile, and it's a difficult thing. You got to feel for these people. These folks don't look this way because they want to. These are people just like you and me. They're proud of themselves. All the people you've seen here and any others I show you, these are people that are out there doing things with their lives. They're working people and they have relationships. And they don't like to be this way. They can't help that they're this way.
So how many for this guy?
4.
4 dental
4 on the
implants?
top. And we haven't really completed his lower yet. We've done something temporary on the lower.
beautiful.
But when we do the lower, we're going to put 4 on the. Look at this.
Are they porcelain? I mean, what are
Yes,
they made
they
out of?
are. they're porcelain, and the important thing is, regardless of what we make it out of, the important thing is look how natural they look.
Yeah, that was my point, because they look really like regular teeth.
Well,
now look at the before and after side by side.
And
he looks more intelligent, more sophisticated.
Well, and he feels that way. And he doesn't. He knew he was intelligent. He knew he was sophisticated.
But people judge you by the way.
But
you
he
look.
knew
No
other
doubt about
people
it.
judged him. Yes. I had a guy in just 2 or 3 days ago. Matter of fact, it was Thursday, and he was in management for a company, and his teeth looked like this, and he lost his job. And then a few weeks later, they called him back and gave him another job, but it was a demotion.
Okay.
And he just recently got promoted back. He's so good at what
After his teeth were done.
his teeth aren't done yet.
Oh, I see. Okay.
His teeth aren't done yet, but he's so good at what he does, that even looking like this, they couldn't keep him down. But he came to see me because he said, you know, Wayne, he said, I'm afraid I'm going to lose my job again. He said, I can't just keep looking like this, and we've got to do something about it.
So their self-esteem is raised after the procedure. I mean, they stand taller, they're more confident.
Well, it's just a fact. You know, their career opportunities are enhanced. Their opportunities for relationships are enhanced.
Okay.
Their entire quality of life is enhanced. And they know it. They just haven't been able to have it done previously.
Now that's not painful. I mean, he doesn't complain about pain.
Are you kidding?
Because this guy, you say, was afraid of the dentist.
Not only is it not painful, it's, as I told you, the next day, this gentleman was back at the office doing his work. So, no.
Except for he's smiling and looking happy
Except
now.
he's smiling and happy, that's right, the next day.
All right, okay, we have time for a few more. Let's take a look. What else do you have? This is a great...
Here's a gentleman. This guy really, this is just one of these people that you can't help but like him. This is a really, really fun, pleasant gentleman. And if you hear him talking, he was telling you about this, he would tell you, because he's told us over and over again, it's fun coming to the office. I like coming in.
It's fun coming to the dental office.
He enjoys it. He's gotten to know the people there, he enjoys them, they're friends of his, and he's just a great guy, and it's fun. You can see how he looked when he started. You can see, just looking at him, he's a happy guy, and just a
So those teeth had to go too, and he just held on to them?
Look at them.
So what, he just didn't smile?
Well, look.
Yeah, I mean,
of course they had to go,
right?
and of course he didn't smile. But you know what, he's a great guy. You know what he tells me?
What?
He said, I am so glad I did this. I wish I had done it so much sooner, because it's really improved my golf game. So,
okay, now
I don't think it's really improved his golf game, but that's what he said.
That's what he said. Well, huge difference in the appearance, by the way. He looked like an old guy.
Well, yeah, look at him.
Now he looks like $1 million.
He's such a handsome guy anyway.
Who designs that smile, by the way? Because they're very nice. You know, going into this, because my problem, even with veneers or anything, seems like you could spot them a mile away. They look like big horse teeth. And these are very nice, very natural.
Well, you know, I design it. Every patient is different. This gentleman has a personality, and he has a facial profile and structure, and he's at a certain age, and so he's going to need a certain type of smile.
Now we have a few moments left. You brought models.
I did.
Different options for denture wears.
I did.
Okay.
And you want to see some
Let's
of
take
those?
a look. Let's take a look.
All right. Well, let's take a look. This is a traditional denture. We can all see what this looks like. We see that it's just a big piece of plastic that covers the entire roof of the mouth, and there's nothing in the world to hold this in except praying for a little suction.
Okay.
Obviously, not too many people would want this, and so for a lot of reasons. One reason might be just the embarrassment of folks knowing that they have something artificial in their mouth. Others might be that they can't enjoy the foods that they want because they can't taste them with the palate being
Palate's covered.
Yeah,
okay.
And that covers a lot of taste buds. People don't like that. This might gag some people where they're just terribly uncomfortable wearing it. Mm-hmm. And others just might not be able to chew well with it because when they try to chew, it moves. So that's a denture. Now with that, there are lots of things that can be done. Everyone that comes to see me, everyone, because it's just kind of what I'm known for doing, what they will come in wanting is something that doesn't ever have to come in and out.
Something fixed.
Something that's fixed. It's
I mean, is it true you can make something that snaps in and out?
Oh yeah, we can do that.
But they like something fixed. Okay.
Mm-hmm. It's an option. It's a compromised option. We'll talk about it in a minute. But that's not what people come in wanting. People come in wanting something that's non-removable, that's fixed. And that's what we usually do. And that's the case where we put in the 4 implants.
4 dental implants?
Yes. Yeah, you probably can't see them very well, but there are 4 implants here. There's an appliance that's made that has these little screw holes in it, and we attach it to those implants. and no one can get it out but me or another dentist that knows how to
So
do
they're
that.
tied up there. They can eat corn on the cob?
They don't go anywhere. They can eat anything, Randy.
Okay.
They can do whatever they want to, but mostly what they can do is not only can they eat, but they can smile just like you can.
All
and they
right.
can have relationships with other people, and no one in the world will ever know that this isn't real for them.
Do they feel like their teeth?
They feel like their teeth in every way, and they look like their teeth in every way.
So why doesn't everybody do that then?
Well, because some people don't find it affordable.
Okay.
Yeah, I wish they did, and we're doing everything in the world we can do to make it affordable.
Because insurance does not cover the things we're talking about.
No, they don't. But you know, insurance doesn't cover a lot of things in our lives that we place a great deal of value on.
But to get your teeth back and your life back, I guess, as you say.
Well, you know, the reality in my practice is this is what people come to me for.
Now, on that back to that 4 implants to give them something fixed.
Yeah.
Same thing with the lower, or is lower you want a little bit more?
Same thing.
Okay.
The lower is even easier than the upper. As far as being predictable and easy.
Now, I talked to a periodontist, by the way,
Yeah.
and nothing against periodontist. What I'm saying is, my show airs nationwide.
Yes.
But I was talking about you. I said, you know, they're talking about 4 implants to secure a lower denture. And she says, I don't think so. It's not stable enough. I don't believe it. And this was 2 months ago.
Yeah.
That's a fact.
Yeah.
What is your response to that?
Well, it's not a fact. I can just.
I mean, is this the opinion nationwide of a lot of other dentists?
Yes.
They don't know about this?
Yes, it is the opinion.
Okay.
It was my opinion at one time. You know, this isn't. I would have been doing this all of my life if I had always believed that this was an appropriate way to do it.
But if they're just tuning in, we're talking about 4 implants to secure and give you something fixed in your mouth.
That's correct.
Okay, and that's possible. So upper or lower?
Upper or lower.
I mean, a 70-year-old, 70 plus could do that?
Doesn't matter. We used to use 8 or 10.
What if you have a touch of diabetes?
Doesn't matter. As long as they keep it under control, they're fine. We don't like to see diabetics, of course, that are their sugar spiking one way and the other. But as long as they're well controlled, it's no problem.
Okay, and oftentimes they go in, and in one day, you put them in, they walk out with teeth?
Absolutely. You know, osteoporosis is another thing. People think, oh, well, I have a little osteoporosis.
Yeah.
Well, that's not a problem either.
Now, we are out of time, but you have one more. You say you could snap in, snap out.
Yeah. Yeah.
Okay, and that's an entry level, or what do you call it?
Well,
like 2 implants?
I call it a compromise. I'm sorry about the time. I've been having fun, but let's talk about that a little bit.
All right.
You know, Randy, I told you, and it's true, it's unfortunate, not everyone can afford to do fixed, non-removable dentistry.
Because insurance doesn't cover it.
Insurance
Okay.
doesn't cover it, and who knows, you know. I had a gentleman in just the other day that needed that kind of work, but he was out of work. He just lost his job.
All right.
You know, I have other folks that maybe just recently became divorced. I have other folks that are retired people that are living on a fixed income, and every penny's so important to them. But they can't live like they are anymore. A lot of times those are people that are already in dentures. They already have full false teeth. And they've been wearing them years and years, and because of the loss of bone that happens for everyone over time as their teeth have been extracted and implants haven't been placed, they get to the point where they can't wear a denture. So we see those from time to time. And there's hope for them too. Just because they can't do this doesn't mean they can't do anything.
Okay.
There are a lot of other things they can do. Let's talk about the other extreme, but something that still really, really helps.
And what is
people.
that?
That's where they come in, they're wearing false teeth, and we do something like this.
And you show them these models? I mean, when you do a consult, I mean, somebody there goes over this with them?
You bet.
Just like this?
You bet,
Okay,
just
good.
like this. Usually it's me.
All right.
And so this patient comes in and they already have false teeth. They're nice false teeth. This happened to be a lower set on this particular patient. There's nothing wrong with them except that the patient can't eat with them. Every time they bite on one side, they move up on the other side. Food gets underneath
Usually
them.
lower denture?
Yeah, more often than not, but
Okay.
not always. Food gets underneath them, they hurt. And they can't eat anything. They usually won't even put it in their mouth anymore. But it's a good denture. So, with a patient like that, we put in a couple of implants.
So this is like a lower jaw?
This is like a lower jaw. We put in 2 little implants. We put in...
So these right here, so these 2 little holes are basically snaps.
Yeah.
And then it snaps right on.
You know, Randy, you probably don't remember these things, but in my generation, we used to get these shirts if it was really special, and they had little snaps. They were usually cowboy shirts,
Okay.
and they had snaps, yeah? And they would snap closed. Well, that's how these work.
That's what this is.
That's what that is, and it works nicely, and it holds the denture in for the patient.
So this would, I mean, for any denture wear, And this would be a huge improvement?
Oh my goodness, Randy, it's a complete change, and they can eat what they want to eat now. They still have a denture. They're still going to have to maintain it like a denture, take it in and out like a denture. They can eat the foods they want. And you know what they hate? People hate putting adhesive in their mouth. How would you like squirting a bunch of sticky, gooey mess in your mouth to hold your teeth in? Okay. People hate it.
They don't like it.
And with this, they don't have to have that.
We're out of time, and this is really good stuff. So anybody missing teeth, especially the denture wearers, what do you say to them? Final message.
I'd say come see us. Let's do a consult and exam. Only costs $250, and when we're through, you'll understand.
$250, they see you.
Yep. I'll be taking care of them personally. When we're finished, they'll understand all of their different options, all of them. They'll have a treatment plan, that's detailed treatment plan, take them from where they are to where they want to go. And if they want to, they can take the same opportunity to talk with a treatment counselor about financing options, and they'll have the big picture.
You say you attract a serious group of people. By the time they get to you, they know they want implants. Is that right?
Yeah, the people that come to see me know they want implants, and they know they want someone like me to do it for them.
And it's not painful. I mean, they don't complain about pain.
They don't complain about pain.
All right, thanks so much for coming on. Good stuff.
Welcome.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this again online or direct a friend to this interview online, visit our website at wellnesshour.com. You could do a search within the site for Dr. Brueggen or dental implants. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.